This week on the Business Owner's Corner, I'd like to talk about establishing a health benefits plan in your business. At some point, growing businesses often decide that they want to start offering health benefits as an employee benefit. Maybe you have employees you want to stick around, or they're requesting it, or you want the deduction, or some combination of all three. A lot of business owners assume that they call a health insurance broker, or maybe they go to their state's respective state's health insurance exchange, and that they're going to offer some health plan that their employees can enroll in directly. That's usually not how it works. Typically, that kind of coverage costs between maybe $3,000 to $5,000 per head per year, and establishing a unique health plan for your business, if you don't have more than a couple hundred employees at minimum, is really not terribly cost effective. So there are a number of different ways to do this. Number one is, in a cost effective way, if you're a member of a professional organization that that has some kind of group insurance plan established already that you can plug into, that's a great way to obtain health benefits for you and your employees. Especially, this is pretty common in professional services, lawyers, accountants, financial planners. There are a lot of group health insurance options available to people in those industries. Other businesses, there may or may not be an option. And one of the alternatives that's a really good starting point and relatively low cost is what's called a health reimbursement arrangement or health reimbursement account. The most popular of these, if you're establishing a health plan for the first time, is called the QSARA. It's an acronym for Qualified Small Employer Health Reimbursement Account. And basically, rather than enabling your employees to opt into a group health insurance plan, you put money into this account on behalf of each of your employees, which they can then take out and use as reimbursement for their out-of-pocket health costs. So if you have fewer than 50 employees, this is eligible to you. If you have more than 50 employees, you have to use a different type of reimbursement plan, but you can set the budget wherever you want. And so if you set it at, say, $200 a month, you put $200 a month into this account for each of your employees. Then when they have reimbursable expenses, which are listed in, I think it's publication 502 of the Internal Revenue Code, but it includes healthcare premiums, prescription drugs, co-pays, visits to specialists, all the stuff that all the expenses we think of when we think of healthcare costs, those are all reimbursable expenses. So basically, you set this thing up to put money into an account on behalf of each of your employees. That contribution is deductible to the business. The employees can then take the money out when they have receipts for their own out-of-pocket costs. This works really well if you have employees who obtain health coverage already, maybe through their spouse's employer. Because if the spouse's employer is covering the premium, you can set these accounts up, and then your health reimbursement account could cover their out-of-pocket costs. There are a lot of ways to set these things up, but just know that the first health plan that most businesses dip their toes into is a health reimbursement account type of arrangement, as opposed to a group health plan that each of your employees can opt into that you pay for. There are a lot of options out there, really good resources in your local state's exchange if you don't have a relationship with the health benefits broker already. But just know that there are a lot of options out there to provide a benefit that's also a deductible expense. And do your research before jumping into one.